Your body needs vitamins to function, but deficiencies are more common than you think. Here's every vitamin deficiency and what happens to your body when you don't get enough. Vitamin D deficiency. Vitamin D is made when sunlight hits your skin, but many people don't get enough, especially in winter or if you stay indoors. What happens? Your bones weaken because vitamin D helps your body absorb calcium. Without it, bones become soft and fragile, a condition called rickets in children, osteomalacia in adults. Symptoms: fatigue, bone pain, muscle weakness, frequent illness. Your immune system needs vitamin D too, and depression-like mood changes. Who's at risk? People who live in northern climates, work indoors, or have darker skin, which needs more sun exposure to produce the same amount of vitamin D. Vitamin B12 deficiency. Vitamin B12 is essential for making red blood cells and keeping your nervous system healthy. What happens? Without enough B12, your body can't produce healthy red blood cells, leading to anemia. Nerve damage can also occur over time. Symptoms: extreme fatigue, numbness or tingling in hands and feet, memory problems, and pale or yellowish skin. Who's at risk? Vegetarians and vegans. B12 mainly comes from animal products. Older adults, absorption decreases with age, and people with digestive disorders like Crohn's disease. The danger: left untreated for years, B12 deficiency can cause permanent nerve damage that doesn't reverse even after treatment starts. Iron deficiency. Iron deficiency is the most common nutritional deficiency worldwide. What happens? Iron is essential for making hemoglobin, the protein in red blood cells that carries oxygen. Without enough iron, your organs and muscles don't get enough oxygen. Symptoms: constant fatigue, pale skin, shortness of breath, brittle nails, unusual cravings for non-food items like ice or dirt, called pica, and cold hands and feet. Who's at risk? Women with heavy periods, pregnant women, people with poor diets, and those with internal bleeding they may not know about why it's serious. Severe iron deficiency can lead to iron deficiency anemia, forcing your heart to work harder to pump oxygen through your body. Vitamin C deficiency. Vitamin C deficiency causes scurvy, a disease that historically killed sailors on long voyages. What happens? Vitamin C is essential for collagen production, which holds your skin, blood vessels, and connective tissue together. Without it, your body literally starts falling apart at a cellular level. Symptoms: bleeding gums, easy bruising, slow wound healing, joint pain, and extreme fatigue. Historical note: scurvy killed more sailors than combat during the Age of Exploration, until doctors realized citrus fruits prevented it, decades before vitamin C was even discovered. Vitamin A deficiency. Vitamin A is crucial for vision, immune function, and skin health. What happens? Your eyes struggle to adjust to low light, and in severe cases, this can progress to permanent blindness. Symptoms: night blindness, difficulty seeing in dim light, dry eyes, increased infections, and rough, dry skin. Global impact. Vitamin A deficiency is the leading cause of preventable blindness in children worldwide, particularly in developing countries with limited access to vitamin-rich foods. Calcium deficiency. Calcium isn't technically a vitamin, but deficiency works similarly and is closely tied to vitamin D. What happens? Your body pulls calcium from your bones to keep other functions running, gradually weakening your skeleton over time. Symptoms: muscle cramps, brittle nails, weak bones that fracture easily, and in severe cases, numbness or tingling around the mouth and fingers. Who's at risk? Postmenopausal women, hormone changes affect calcium absorption, people who avoid dairy, and those with vitamin D deficiency, since the two work together. Vitamin K deficiency. Vitamin K deficiency is less common, but critical because of its role in blood clotting. What happens? Without enough vitamin K, your blood can't clot properly, leading to excessive bleeding from even minor injuries. Symptoms: easy bruising, bleeding gums, blood in urine or stool, and heavy menstrual bleeding.
Who's at risk? Newborns, which is why they receive a vitamin K shot at birth, people on long-term antibiotics, and those with digestive disorders that prevent proper fat absorption, since vitamin K needs fat to be absorbed. Folate deficiency. Folate deficiency is especially critical during pregnancy. What happens? Folate is essential for cell division and DNA production. Without enough, red blood cells can't form properly, and in pregnant women, the developing baby's neural tube may not close correctly. Symptoms: fatigue, irritability, mouth sores, and in pregnancy, an increased risk of birth defects like spina bifida. Why it matters. This is why doctors recommend folate supplements before and during pregnancy. The neural tube forms within the first few weeks, often before a woman even knows she's pregnant. Most vitamin deficiencies develop slowly and quietly, showing up as fatigue or minor symptoms long before anything serious happens. A balanced diet prevents most of them, but if you're experiencing unexplained symptoms, a simple blood test can reveal what your body might be missing. If you want every blood type explained next, let me know. Subscribe.